So let's start this class. If after the completion of this class, if anyone found any difficulty for language wise, like if anyone unable to understand English properly and he want some Hindi description, so can send me the direct WhatsApp on my number. So I will send the Hindi videos. तो अगर किसी को भी समझने में कोई भी प्रॉब्लम हो तो मुझे व्हाट्सएप करिएगा, तो मैं आपको हिंदी वीडियो भी भेज दूंगा. Okay, so let's start now. So we are discussing, our topic is abdominal diagnosis. And in the yesterday discussion, we have seen the abdomen is representing the full human body. We can find out the head or brain. We can find out the heart and lungs. We can find out the each and every structure on the abdominal region. So when we want to become a perfect in the diagnosis, then we should have little knowledge of the 5 elements. So let's have a brief discussion of the 5 elements. So as per the 5 element chart, and while doing the abdominal diagnosis, if I tell you the gallbladder, so you should understand what is the meaning of gallbladder here. So as per the 5 elements, when we talk about the element number 1, so we should understand what is the meaning of element number 1, what is the meaning of element number 2, what is the meaning of element number 3, what is the meaning of element number 4, and what is the meaning of element number 5. If we are having this knowledge, then we can take the very good benefit of the abdominal diagnosis. Because the meaning of element number 1 is liver and gallbladder. If there is any joint pain in the body, then we will find the tenderness either in the gallbladder or in the liver. So this is the language of 5 element. Just do not think that if I tell the gallbladder, just do not think that gallbladder is just a gallbladder organ. Always think, number 1, the meaning of gallbladder is a gallbladder organ. The meaning of liver is a liver organ. And the other meaning of liver and gallbladder is a joint. Because we know the joint is made by multiple structures like tendons, like ligaments. So these anything happen in the body. Suppose someone is having the knee joint pain, then we may find the pain either on the gallbladder point or in the liver point, or someone is suffering with a ligament injury, then we will find the pain either in the gallbladder or in the liver. Or someone is suffering some tendon problem, like tendon is like a ropes who are tightening one bone to another bone, bone to muscles. So this is the binary language. So whenever we find the tenderness, either in the liver or gallbladder, in the abdomen, we always think about the number one, liver organ, number two, gallbladder organ, number three, the problem in the joint, or there may be the joint pain, or there may be problem in the tendons, or there may be the problem in the ligaments. These all things are under the first element, which is called liver and gallbladder. So if we are going in this image, so this is the abdomen. In this abdomen, this is the diaphragm, and this is the central line. So we can feel this lower part of the ribs or lower part of the diaphragm. Everyone can feel it. If you keep on going like that from the chest cavity, then we can find this lower part. And the person who is very lean and thin, this part is very easily visible. And we know in this part, if we see the right side, this is the point of gallbladder. This is the point of gallbladder. And if we see on the left side, this is the problem of spleen. Shortly, we will also discuss the liver point. Right now, we are discussing 2 points. Who is available in this diaphragm line? So when we want to see the tenderness is there or not, what we are doing? From the nipple line, we are going down, 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 reaching on the rib and pressing that point. So look at me. So from the nipple line, going down, 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 and this is the last part. This is the last rib. Now I am doing the pressing on the border of bone. And I can do little pressing here and little pressing on the other side also. So I can cover this much area. If this side is painful on the left side, this indicates the problem of the spleen. If this side is painful on the right side, the lower border of rib, this indicates the problem in the gallbladder. And I told you, if there is a pain on the gallbladder point, it indicates either there may be the problem in the tendons, or there may be problem in the ligaments, because nowadays many people also suffering with a ligament injury while playing the football, cricket. Many sportsmen also suffering with a knee ligament injury while accident and falling down also may suffer with a ligament injury. So if there is any ligament injury or joint pain in the body, then this point will be tender and painful. Otherwise, this point will not be tender and painful. So when gallbladder is tender and gallbladder is painful, it indicates either the problem in the gallbladder organ or in the problem in the tendons and ligaments and joints. So when we are learning the acupuncture, acupressure, or these therapies, we are having multiple points connected with the gallbladder. As soon as we treat the gallbladder point, this pain will disappear. After 5 minutes, after 10 minutes, or after one day, we will press same points and pain will not be there. As well as the joint pain, the ligament pain will reduced. So this is something like that. We are not asking the patient what is your problem. Maybe he's having knee pain, maybe having ankle pain, maybe having some other joint pain. We are just asking the patient whether you are having pain here or not on the location of gallbladder. If he's telling yes, then we are treating the gallbladder and we are finding the result, whatever the reason. Few days back, one patient came to me. When he was walking, he was unable to keep the leg on the floor. He was walking like lifting the leg little up, one leg. Since many years, I did the abdominal diagnosis. The gallbladder point was painful, but I cannot tell the patient that your gallbladder is problematic because he's a young guy. Physically, he's not having any gallstone. He's not suffering with any problem which can be told with the gallbladder problem, but he's having the problem. The lifting the leg, like one leg he can keep properly on the floor, but one leg he's unable to keep on the floor fully, lifting little up from the heel side. So he was when walking, so body was moving in a very peculiar way. So he was having pain in the gallbladder point. I treated the gallbladder, and next day he told, after many years, first time, I am able to keep my leg on the floor. Because even I don't want to know why he is not keeping the leg. Just I am doing the abdominal diagnosis. Whatever output coming, I am treating, and we can see the results in the patients. In the same way, if we go on the other side, so we can see it is spleen is written here. One patient came to me with the problem of some indigestion and loose motion. I checked the abdomen all around. I found the tenderness at this point, on this spleen point. Because if someone is suffering with the abdominal pain, it may be because of the stomach, it may be because of the small intestine, it may be because of the large intestine. We don't know. Or we have to do lots of investigation, lots of reports. It will take more monies, more time. So just I pressed on the abdomen and I found the tenderness on the spleen point. I just treated the spleen point. I just treated the spleen. And we can treat the spleen with any method because there are multiple methods available. Like we are having many points in the body, many points available in the different part of the body, like in the ear, in the body, in the face, anywhere. Our target, just treat the spleen. If we treat the spleen, I treated the spleen, and then he told that now I'm not feeling any bloating in my stomach. Loose motion stopped. If we see the acupuncture or acupressure or the 5 elements, so this is the 5 element. The first element include the liver and gallbladder. Second element The second element include heart and small intestine. Nowadays, we see many patients are suffering with the problem of heart. Many patients suffering with the problem of small intestine. So this is the second element as per the 5-element concept. So if someone is suffering with a heart problem, palpitation, suffocation, chest pain, angina pain, high blood pressure, any problem which is connected with the heart, or someone is suffering with the problem with the small intestine, indigestion, and many more problems. So we are focusing on the second element. So this is the second element, which include heart as well as small intestine. As per the 5-element theory, if we want to treat the blood vessels, because blood is running inside the blood vessels, heart is pumping the blood who runs inside the blood vessels. If blood vessels is not good, if blood vessels become narrow, it will create high BP. Many times patients are getting high BP because of blood vessels become narrow. Why? Cholesterol deposition or some blockages. There may be multiple different types of depositions. If there is anything happen wrong with the blood vessels, it will affect the blood pressure. So if we want to treat any problem which is connected with the blood vessels, either with the high BP or any other problem which is connected with the blood vessels, so we always treat the second elements. Suppose one patient is coming to you and he is having blockage somewhere in the legs. So one patient is coming to you and he is complaining you that I have blocked blood vessels in the leg or anywhere in the body. If there is anything happen with the blood vessels, so there will be tenderness or hardness either in the heart or on the small intestine point. So if heart is tender and painful, the point of a small intestine is tender and painful. So it's so there may be problem in the heart, there may be problem in the small intestine, or there may be problem in the blood vessels. So if we want to treat them, we should treat the heart or small intestine. So when we see the abdomen, so look at here. In the abdomen, this is the chest bone or sternum bone. This is called chest bone or sternum bone. If from this we go down, 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 down till the navel, this total length is 8 chun or 11 fingers. So now, and we know this is the diaphragm. This is the diaphragm. Fine. And this total length, as I told you, is 8 chun. Now, what is the next? If someone is suffering with a pain just below the sternum here, just below the chest bone here, if this is painful, this indicates some problem in the brain. Maybe person is suffering with the problem of sleep, or maybe suffering with any problem related with the anxiety, depression, any brain related disorder like Parkinson, like multiple sclerosis. If this point is painful, then we have to treat the brain. So we can declare to the patient that you should take care of brain. If this point is painful, just below the chest bone, just below the sternum bone. Because what is happening, if any patient coming to you, doctor, I am having some problem in my stomach, but you are not finding pain anywhere in the stomach, just you are finding pain on the brain point. Then we can tell him, okay, just take your brain, your stomach problem will go away. And this is happening in reality. Sometimes what happened, some person is doing night job, unable to sleep properly, lots of stressful, having some problem with the brain. And the second effect coming coming on the digestion. So as soon as we treat the brain, other thing become automatically normal. So this is called brain point, just below the sternum bone, just below the sternum bone. So we found here this point belong to the gallbladder, this point belong to the spleen, and spleen is connected with the digestion, and spleen also connected with the pancreas, or we can tell pancreas. So if the pain in the left side under the rib, this show either person suffering with the digestive problem or with the problem in the spleen or problem in the pancreas or maybe diabetes. But do not declare all the time diabetes, because the function of the pancreas are not only controlling the sugar, there are many other functions also. So if someone is having pain in the left side, this is definitely sure the person having digestive problem. And the pain in the right side, this is the problem in the gallbladder. And but if pain in the central, just below the sternum, this is connected to the brain. So we found 3 points, which we discussed yesterday. So till here, we have already discussed yesterday. Now we'll proceed for the next. So let's see here. So look at this image now. So I am making the diaphragm again here. And this is the brain point. This is in the nipple line, in the right side, this is the point of gallbladder. Another side, this is the point of spleen or pancreas. Now, if we draw a horizontal line from gallbladder to spleen, so the center point is called P. P, the meaning of P means pericardium. Pericardium. When someone finds pain at this pericardium point, it indicates 2 problems. If someone is suffering pain in the pericardium, because pericardium is connected with the brain, also pericardium connected with the digestion. So if someone is having pain in the pericardium, it's very clear, number one, person having digestive disorder, maybe gas, acidity, indigestion, and second, he's suffering. Also, brain problem means anxiety and something like that. So the pericardium show 2 conditions. pericardium. So two conditions. Number one, gas acidity in digestion. And number two, problem in the brain. So when we praise this point, if this point is tender and painful, we declare immediately that you should take care your digestion as well as you should take care your brain. Maybe you're working a lot, maybe you're taking a lots of stress. So that's why your digestion is also impaired. So in this way, this is a very good diagnostic point to find out whether person is suffering with some gas related problem, digestive related problems or not. Let's see the same thing in the other image. If we look at this image, so I'm taking the support of this image because everything, diaphragm and everything is very clear. So we can see how this lower part of the rib is going and making this curve. We can see here. This curve may be higher or lesser for every individual. So now, first what we'll do, first we'll make our brain point. So this is the brain point. Just at the below of this chest bone. This is the brain point, and this is just below this bone. The name of this bone is chest bone or sternum bone. After that, if suppose nipple is here, one nipple in the right side here, one nipple in the left side here, if we go and follow the vertical line from the nipple, both the side, then this is the point of gallbladder in the right side, and this is the problem of spleen or pancreas on the left side. The spleen or pancreas is also connected with the digestion of fat. So if someone is unable to digest the fat, there will be pain and tenderness on the spleen point. Now what we'll do, we will unite the point of gallbladder and spleen together like that. So just middle point, this is the point of pancreas, this is the point of pericardium, P. The meaning of P here is pericardium, pericardium, which is connected with gas and brain. So if we find the tenderness at this point, we can declare very immediately, oh, you're having the problem of gas, you're having the problem of something connected with the brain. So in this way, we found another point which is also giving us very good information. Either this is the pain, or either this is the brain disorder, or this is the gas related problem. Now let's proceed for the next point. So just here, I want to tell you one more thing. The upper one is the brain point, and this lower one is the point of pericardium. If we just take one more point in the center, in between, that is the point of heart. That is the point of heart. Let's see once again, because this may be a little complicated, but it is not complicated, it's very easy. Let's see once again. So look at this image once again. So this is the brain point. This is the gallbladder point. This is the spleen point. And in between, this is the pericardium point. Now, in the center of these both, this is the point connected with the heart. So if we want to serve the heart, another way to find out the heart, what is the another way? I will tell you in the other image, the next image, let's see. So what is another way to find out the heart? This is a thumb and this is a thumb width. So keep your one thumb here. This is a thumb. So near about one thumb width is a brain. And after that, this is the heart. So next point will be the heart. And after that, the next point will be the pericardium. So in this way also, in the sequence, upper part is a brain, then the next part is the heart, the next part is the pericardium. In this way also, 3 points we can understand in a sequence. If someone is suffering with the tenderness in the heart point, definitely it's so. What is the meaning of if someone is suffering with a tenderness in the heart? If someone is having the problem of insomnia, some emotional ups and downs, some heaviness on the heart, something is stuck in the heart, or even some blockages, even some heart-related disorders, palpitation, pain of the heart, angina pain, anything which is connected with the heart, so we will find the pain on the heart point. So in this way, these are the 3 points. We can find one after another 3 points. Upper one is the brain, who is just below the sternum bone. The next point will be the heart, and third point will be the pericardium. So this is a very good diagnostic tool. So definitely, if someone is suffering with the problem in the memory, so actually the memory is the result of heart, and so we have to go as per the 5 element. As per the 5 element, retention done by the spleen. But if we talk about the just memory here, so it is connected with the brain here. So if someone want to improve the memory, just do the diagnosis first. Check whether brain is painful or not. Oh, it is a little painful. Then definitely you have to treat the brain. But if brain is not painful, brain is okay, this point is not tender, then leave this point and search other point. Whatever the problem is this, like we are not treating the symptoms. The patient is coming to us and we can tell, okay, keep quiet. Don't tell anything to me. I will do diagnosis and I will treat you. You don't allow the patient to speak any word. He's not telling you that he's suffering with a memory problem, he's suffering with a brain problem, he's suffering with a heart problem, he's suffering with a digestive problem, he's suffering with the problem of gas. Just you're doing diagnosis. Oh, pericardium is painful, gas and brain, treat the pericardium. Oh, heart is painful, treat the heart. Whatever the problem is this. One patient came to me for the treatment of epilepsy, but brain point was not painful. Just lungs point was painful. I treated the lungs and I got success. So our body is so, we can tell it is so secret. This body is so secret. You're having gas, but you're feeling disturbed in your brain. You're constipated, You're not feeling good enough in your mind. Even during the menstruation, female having some irregular menstruation, irregular period, and mood is fluctuating up and down. So if mood is fluctuating up and down because of the irregular period, so we have to treat the period, not mood. So in this way, whatever the problem is this, we will go on the abdomen, check the tenderness. Wherever we find the tenderness, we will treat the point. So let's proceed now. So now in this image, we can see here, if this is the diaphragm, so this is the gallbladder, this is the spleen, brain, at the level of gallbladder and spleen, this is the pericardium. Here the meaning of PV is pericardium. Who is connected with the brain and gas. Here the meaning of GV means gallbladder. Here the meaning of spleen is digestion or pancreas. Digestion as well as pancreas. So now what is our next point? Between brain and pericardium, this is the center point. And this is connected with the heart. This is connected with the heart. So yesterday we have seen the right hip bone and left hip bone. If someone is suffering with a pain in the right side hip bone, this so the condition of the right kidney. If someone is suffering with a pain in the left side of the hip bone, this so the condition of the left kidney. So we are pressing here and this hip area is painful, then it shows the condition of the right kidney or left kidney. The meaning of right kidney and left kidney we should understand as per the 5-element language. As per the 5-element language, whenever we talk about the kidney, the meaning of kidney are number 1, bones, and number 2, reproductive part like ovary. Like ovary in the female and testes and prostate in the male. So number 1 is a bone, and number 2, ovary and uterus in the female and testes and prostate in the male. This come under the kidney. So when there is a tenderness in the kidney, always think in this way. Do not tell the patient that your kidneys fell. Now you are going to die. Kidney is not working. You are having too much pain. You are suffering with a kidney failure, chronic kidney disease. No, not like that. The meaning of kidney is bone. The meaning of kidney is ovary and testes. And the meaning of kidney is definitely kidney as well. So if someone is suffering with a pain in the right side of the hip bone, it indicates either the person having some problem in the right side of the bones. So if we press here on the border of the hip bone, if this is painful, then we can tell the person, number 1. We can think in our mind that right kidney is weak, but we cannot tell the patient. Even don't write on the prescription, write in the code word, write KD minus, that's it. Because if the patient see you're writing something, right kidney is weak, he will get scared and he will run to the other doctor and both together will declare you full. So be aware for that. So the right kidney weak means the bone of the right side is weak. Person may suffer with the right shoulder pain, right hip pain, right knee pain, or maybe some problem connected with the ovary, maybe right ovarian cyst in that way. Same for the left ovary. And we also discussed yesterday a little more about that. So I'm not repeating all the things today. So let's proceed now. So finally, we have seen two more points here. Right kidney, left kidney. Okay. This is the naval region. So this is the navel region. Now, this is the gallbladder. This is the spleen. This is the right kidney. This is the left kidney. Okay, we found these structures so far. Now let's proceed and continue to see what is available in the central line. So the upper point is brain. Then on the level of this gallbladder and spleen, we are having the point which is called pericardium. Pericardium. And in between the pericardium brain, we got heart. So till this, we have discussed all the things. Let's proceed now. Okay. Now what we have to do? From the navel till the lower end of the sternum, this total length is 8 chun. If we take one point at the center of this, if we take one point at the center of this, so it will be 4 chun from here and 4 chun from there. Let's see in other image. See, right now we are discussing diagnosis. Treatment part will be discussed in the course. But if you are a healer of any field, then you can do the diagnosis from here. And you can apply point from your method. Because if I tell you the treatment of pericardium, brain, heart, spleen, gallbladder, right kidney, left kidney, small intestine, large intestine, liver, lungs, all, it will take long time. So that is the part of course. But right now I will complete the diagnostic part. So let's see in the other image. So look at here. So this is the navel region. And this is the sternum bone or chest bone. The distance between these two parts are 8 chun. That we know 8 chun. If in between we take one point, in between we take one point, that point is very famous for all the stomach related problem. So this is a very good point for the stomach. And with that small point below the stomach, that is called the first part of small intestine, or we tell it duodenum. We tell it duodenum. So the upper one is the stomach. So upper one is the stomach. And if we take one more part here, that is duodenum altogether. So when we are pressing here and if it is painful, it indicates the clear problem connected with the stomach, or there may be problem with the connected with the duodenum. What is duodenum? Duodenum, as soon as we eat the food, it is going in the food pipe, then it is going in the stomach, and after stomach, it is going in the duodenum. The duodenum is the first part of small intestine. So in this way, we have to see the lower end of the sternum, and we have to see the navel, where we are having navel, and just in between we are having stomach point. I will also show you the practical demonstration. So this is the thing. So this is called stomach or duodenum. Now, the next point, if from the navel region we go down, if from the navel region we are going near about 2 chun down, how can measure 2 chun? With the help of 3 finger. With the help of 3 finger, we can measure the 2 chun. So from the navel region, if we are going 2 chun down, that is the point called the point for circulation. So if someone is suffering with a circulation problem, circulation is not proper in the arm, or circulation is not proper in the feet, or circulation is not proper anywhere in the body, then this point will be tender and painful. In the acupuncture or acupressure language, we also tell it triple Barmer or TW. This point is just 2 chun below 2 chun, meaning 3 finger. Now, at last, if we go down, 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 then we will find the bone here. This is the pubic bone. If we press the pubic bone, and if this is painful, so this is showing the condition of urinary bladder. So this is called the triple Barber, and this is urinary bladder. So if someone is suffering any problem which is connected with the UV channel, urinary bladder, this point will be painful. Let's see in the other image. So if we see the navel, from the navel, if we go 5 chun down, 5 chun can be measured with the help of 7 fingers. 7 fingers. So as soon as we go 5 chun down, we will find the pubic bone here. Pubic bone. And this is the pubic bone, and this is also the point of urinary bladder. So let's discuss all the center point. So making the center line, this is the chest bone or sternum bone. So this will be the first point, which is called the brain. This is the second point, which is called heart. This is the third point, which is called pericardium. Now, this is the fourth point, which is called stomach. With that, we are having duodenum. Now, if from the navel region, if we go 2 chin down or 3 finger down, that is a point of triple Bormer or circulation. And at last, this is the point which is connected with the urinary bladder channel. So in the single line, we are having multiple points. So let's see the other image. So look at this image. The upper point is brain. This upper point is brain. The second point is the heart. Then third point here, it is very smaller, that is pericardium. Then fourth point is the stomach. Then this is the navel region. Then this is the point of circulation. And at last, we are having here urinary bladder points. So we can see all the points available here. If we press them, and if they are tender and painful, so they indicate the problem with the connected meridian and connected organ. So let's see in the other image. So look at this image. So this is the central line. This is the chest bone. Below the chest bone, this is the location of brain. This is the location of heart. The second is the location of heart. And third is the location of pericardium. Now this is the stomach. Circulation. And this is the UV channel. So I'm writing down all the organs. Brain, heart, pericardium, stomach with duodenum. This is the navel region. This is the circulation. And this is the urinary bladder. Now, what we have to do, from the area starting from the heart till the stomach, we can consider this part as a number 1. The meaning of number 1 is heart to stomach area. Now from the area from the stomach till the circulation, we can consider is a number 2 part. So the meaning of number 2, from the stomach to circulation or triple Bormer. Now, from the area from the circulation till the urinary bladder, we can consider is a number 3. So the meaning of number 3 is starting from the circulation TW to UV. And finally, the last, after UV, the area which is available after UV. The below the UV, this area. below the UV. So we'll make the same image in other. So now we are making the same image here. So this is the sternum bone, brain. Now this is the heart till the stomach. This is the area number 1. The upper one is the heart and lower one is the stomach. Now from the stomach till the triple border circulation, it is area number 2. So this upper one is the area number 1 and this is the area number 2. Now from the triple warmer till the UV channel, this is the UV channel. This is the area number 3. And below the UV channel, this is the area number 4. So we got 4 areas. One area starting from the heart to stomach. Second area starting from the stomach to triple burner. Third area starting from the triple burner to urinary bladder. So first area represent cervical spine, neck or cervical spine. If this is painful, then it shows the condition of cervical spine. The second area represents the thoracic spine or upper and middle back, thoracic spine. If this area is tender and painful, this is the condition of any pathology, any problem in the thoracic spine. And the third area is represent the condition, any problem in the lumbar spine. And the fourth and final area represent the condition in the sacral spine. So let's see this thing again finally. So from this is the brain point or upper one point. So from the heart till the stomach, this is the cervical spine area. C1, C2, C3, C4, C5, C6, C7, cervical area. And from the stomach to the triple burner, this is the thoracic area, and we are having T1, T2, T3, T4, T5, T6, T7, T8, T9, T till T12. And from there, this is the lumbar area till the urinary bladder, lumbar 1, 2, 3, 4, 5, and finally down we are having sacral area, sacrum coccyx. So we are having whole spine here. So the upper one is cervical spine or neck. This is the thoracic spine. This is the lumbar spine, and this is sacrum. I don't know whether this is becoming complicated or easy because I am going a little faster because of I have to finish the subject today. But if we know the accuracy, if we know the point, if we praise there and we find the pain there, then it's so. The condition connect with the cervical region, connect with the thoracic region, connect with the lumbar region, and many times just we praise, and patient also feel good. He also feel relief. So this abdominal diagnosis become the treatment also. So this was the completion of the central line. The last part of this abdominal diagnosis. So let's see in this image. This is the gallbladder. This is the spleen, kidney, kidney. Now what we are doing from the navel region, we are connecting the gallbladder, connecting the spleen, connecting the kidney, and connecting this kidney also. And just in between, we are taking one point. So we got 4 more points. So if we press on the right side, if this pain is tender and painful, so this point shows the condition of both lungs. And if we press on the left side, if this point is painful and tender, this shows the condition of liver. I am telling you once again, the liver is available in the diagnostic area. The diagnostic area of the liver is on the left side, because after every class, few participants ask me whether I am wrong, because sometimes people think that by mistake I am taking liver on the left side and I should take liver on the right side. The organ in the body in the right side, but as per the energy concept, this diagnostic point of the liver is available on the left side only. Right side, we are having both lungs. If you see in the right side, from the navel, if we connect the kidney. So this is the small intestine and the left side. This is the large intestine. So when we are pressing the points, we are finding the exact tenderness. So I told you the history about the patient came to me for the treatment of epilepsy, was having tenderness pain in the lungs. I treated the lungs for the epilepsy treatment because in the diagnosis, the tenderness was coming on the lungs. In the same way, many times the problem is coming in the small intestine, problem may be anything. So we have to treat as per this image. So let's see, finally summarize all the things. So gallbladder, spleen, brain, right kidney, left kidney, making 4 lines. Lung, liver, small intestine, large intestine. Now making the central line. Heart, pericardium, stomach with duodenum, triple Barmer, and urinary bladder. So this is the final, the graph of all the points available in the stomach region. I will show you other image. Look at this. This is the same image. You can take the screenshot, you can click this image. So this is the abdominal diagnosis. Let's see one practical video. So we have to apply the pressure, very little. We don't have to press very hard. So many times people are suffering with a multiple side pain. It's not necessary that all the person having pain only at the one location. Pain will be available at many parts. So we have to treat many. Like someone is suffering with the problem of the liver. Also, he may suffer with the problem with the lungs, also in the pericardium. Then we have to treat 2-3 organs together. So I have kept one video for all of you. So let's see that video. So look at this. So now we are doing the abdominal diagnosis. So when we are doing the abdominal diagnosis, so this is the sternum bone. This is the lower end of the sternum bone, or the name of this part is also called Jiffy sternum, the lower end of the sternum. This is the navel region. The distance is 8 chun from navel to Jiffy sternum. This is the length is 8 chun. So we can measure, this is total is 8 chun or 11 fingers. So this is the navel region to the pubic bone. This length is 5 chun. So 4 finger, then 3 finger. So this is the length is 5 chun from the navel to the pubic bone. So now we can know the total length we understood. From the navel, if we go up, that is 8 chun. So this is the uppermost point, or this is called brain point. If we press there, and if painful, any pain point is painful. So it's so the pathology of connected organ, and we have to rectify with any treatment. So this is the uppermost point of brain point, which is connected to the brain. The problem may be in the brain, problem may be in the cerebrum, cerebellum, basal ganglia, any part of the brain. So we are pressing this point, and if this point is tender and painful, so this point, so the pathology and the problem of the brain. So we are, see, I am drawing the round circle. Now pressing in the center. The pressing in the center, so this condition, so the brain related problems. Like someone is suffering with the Parkinson, multiple sclerosis, any brain related disorders, we treat that. Now we are coming to the next point. In the nipple line, we are going down and marking 2 points in the nipple line under the last rib. And if this is the tender and painful, so if this is the tender and painful in the right side, so this is the pathology connect with the gallbladder. But if this is painful and tender in the left side, so it's so the pathology in the spleen or pancreas. So we are pressing the last rib, and if it is tender and painful, so we can declare the person is suffering either problem the gallbladder or the problem the spleen as per their respective areas. So if this is pain in the left side or right side, now we are combining both the points together, gallbladder with the spleen. Now the central point, the point just in between, this point is called the point of pericardium. If we press here and if this point is painful, this point shows the condition of brain as well as gas. So if we are pressing here and person is telling, yes, I'm having little tenderness, then it's so person is suffering with gas, acidity, indigestion, or something related with the brain. Maybe he's not taking good sleep, good rest, good relaxation. So now, between the brain and this pericardium, between the brain and pericardium, if we are taking one more point, that point is connected with the heart. So this point is showing the any condition, any pathology which is connected with the heart. So if this point is painful, which is just in between, that is heart. Now this is the navel region. From the navel region, if we are going 4 chun up, near out 4 chun up, that is the point connected with the stomach. If we press here, if this is tender and painful, this shows the pathology of the stomach, or person may suffer with the gas, acidity, any problem in the stomach. So this is the point connected with all the disease and disorder connected with the stomach. So if left side is painful, that is spleen. The left side, the lower part of the rib, that's the condition of spleen. And when we press the lower border, so that spleen also can be considered as a pancreas. And this point is connected with the stomach. So we are pressing this, and just below that, we are having one small structure, that is duodenum. The duodenum is the first part of small intestine, which is just connected with the stomach, and food go in the stomach, then go in the duodenum. So many patients suffering with the ulcer in the duodenum, gas, acidity, then duodenal point is painful. So in this way, we have seen all the points in the line. So this, we are continuing the line. This is the navel region. This is the navel. Now from the navel, if we go near about Tuchun down, Tuchun can be measured with the help of 3 fingers. So this is the triple Barmer, TW, or circulation. So if there is a poor circulation in the body, this point will be tender and painful. So when any person is unable to get the poor good circulation in the each and every part of the body, this point may be painful. So this is called circulation. Many times we see if we touch anyone, hand are icy cold, feet are icy cold. So means circulation is not proper. It shows the condition of triple Barmer. If we go down, so this is the pubic bone. This shows the condition of urinary bladder. From the navel region, it is 5 tune down. This is the pubic bone, we can feel here. On the pubic bone, we are having urinary bladder. So this is the point, urinary bladder. So we have seen all the point in the central line. Now this is the heart. If from the heart till the stomach, we are drawing a line that is called cervical. So from the heart till the stomach, we are drawing a line that is called cervical 1 to cervical 7. Even we can equally divide and we will find each and every cervical vertebra, C1 to C7. So this shows the condition of cervical vertebrae. Many times patient is suffering with the cervical pain. Now from the lower part of the stomach till the triple Barmer, if we draw a line, this is called thoracic region, or T1 to T12. If we place here, if this is tender and painful, it shows the condition of any problem in the upper back or middle back or thoracic pain. So this is T1 to T12 area. Now from the triple Barmer till the urinary bladder, if we draw a line, this shows the condition of lumbar area, lumbar 1, 2, 3, 4, and 5. Nowadays, lots of people suffering with the lower back pain or lumbar pain. So this area will be tender and painful. So this area is called the lumbar area. If we place here, if it is tender, many times we insert the needle here and person is getting pain relief in the lumbar area. So in this way, we can see hold the spine to the lumbar here. So this is the, now after the urinary bladder, if we go down, after the urinary bladder, if we go down, that will be the sacrum or coccyx area. So in this way, we can find whole spine here. Now from the navel region, if we draw a line till the gallbladder, if from the navel region, if we draw a line till the spleen, if the navel region, we draw a line till the gallbladder, just middle point is lungs in the right side. In the left side, this is the liver. If we press here and these are tender and painful, it shows the pathology of the lung. The person may be suffering with a cough and cold, any lung related problems, or the left side, so the condition of liver. The person having some problem connect with the liver. Now from the navel region, if we draw a line till the right hip bone, or left hip bone, or the kidney point till the kidney point, just middle point, that is small intestine in the right side, the middle point is large intestine in the left side. So if we place in the right side, it is painful. So the pathology of small intestine. In the same way, we can place at left side. And if that is painful, It's so the pathology of the large intestine. So you can see my touch. I am pressing very gently. Just we have to give little pressure. We don't have to press vigorously. So in this way, now we are pressing the upper border of right hip bone. So this is the upper border of right hip bone. If this is tender and painful, this shows the pathology of the right kidney. The right kidney is connected with the right side of body bones, right side of ovary, right side of the body. Right kidney is painful. It's so the pathology of the right side. So we can ask the patient, if left side is painful, then we can ask whether you are suffering with the pain in the right side somewhere, like right knee pain or left knee pain. So wherever this pain is, if the right side, it's so the problem in the right side of the body, or pain in the left side of the kidney, it's so the problem in the left side of the body. So in this way, we can find out any pathology happening either in the right side or on the left side. So in this way, these points are helping to diagnose the patient very properly. This diagnosis is very accurate, very easy. Anyone can do this, but very, very accurate and very perfect. If you just treat the point, whatever you got with the help of this diagnosis, you just treat the point, then you will see the person is getting the relief in the body. Whatever the problem is, this maybe suffering with the brain disorders, maybe suffering with the stomach related disorders, maybe suffering with any different types of disorders, we can rectify the problem. So this was the completion of practical video. I hope you have understood that.